This is Lily, and we're about to start a Rejuvalift procedure. The benefit of Rejuvalift is the fact that it's affordable, it's long-lasting, results are instantaneous, and it's a procedure and not an operation. Part of the Rejuvalift is using a neuromodulator such as Botox to weaken dynamic wrinkles, and the most common areas to inject Botox are in the upper third of the face. Areas such as the frown line area, the forehead, and in areas such as the crow's feet. In addition to the use of a neuromodulator such as Botox, we typically use a filler such as Restylane. The filler can be utilized in areas such as the tear trough, which accentuates the lower lid bags, and by filling in the tear trough, this will camouflage these. Using filler in the medial cheek, which is an area that people tend to lose volume with age. Filler in the nasolabial fold or the smile lines. Pre-jowl area in this area, which will camouflage early jowling. Now she's had the numbing cream on now for about 20 minutes, and we're about to start the procedure, and we'll start with some markings. So I'm going to have Lily frown for me, and so you can see the frown lines that we're trying to improve with the use of a neuromodulator such as Botox. And these are the areas of planned injection to weaken those muscles so that she can't create those kind of dynamic wrinkles. I'm going to get you to relax now, and then I'm going to get you to raise your brows for me. And you can see the forehead, transverse forehead wrinkles. And similarly, we'll mark her for injection of Botox in the forehead in order to minimize those areas of wrinkling. Perfect. And now you can relax. And then we're going to mark the crow's feet area. And I'm going to get you to squint for me. There you go. And Lily doesn't pull very strongly in the crow's feet, but she does have some early static wrinkling in addition to dynamic wrinkling, and that will benefit with Botox. So the next thing we're going to mark is the areas that will benefit from filler. And the first area that will benefit from filler is the tear trough area. And that's a depression that's located below the lower lid, which tends to accentuate lower lid bags. And I'm going to get you to look up just above the door there, Lily. And so this is the area here that we're going to start marking with a pen. The next area that I'm going to mark is the medial cheek, which is an area that tends to get deflated with age and lose volume. The next area is the nasolabial fold or the smile lines. The next area is the marionette zone, which in Lily is very subtle. And the pre-jowl sulcus, or the area just in front of the jowls, which once again is very subtle in Lily's case. And Lily also has a slightly under-projected chin, a slightly weak chin. And to balance the contour a little bit, we're going to mark the chin, and we may inject some filler in the chin to improve her contour a little bit. We're ready to start injecting, and we've cleaned the skin. And we're going to start with a neuromodulator such as Botox in the upper third of the face. So we're going to start by injecting the glabellar area, which is the frown lines. And we're going to start with the first injection. A little needle poke. Little stretch. Needle. So Lily, how did you find that first series of injections?
It was okay. Felt like a mosquito bite.
Perfect. All right, we're going to carry on. We're going to start with the forehead now. Needle. All right, so we're going to start now with the crow's feet area. I'm going to get you to turn just a little bit for me. That's perfect. Little needle poke. Then we're going to switch sides to the other side. And sometimes this injection of the crow's feet area can also give you a little bit of a brow lift. Okay. Next we're going to start with the use of filler, and we're going to start with the lower lids or the tear troughs. This particular filler is Restylane Fine Lines. And we'll get you to relax and take normal breaths, okay? You'll feel a little bit of a stretch. And you can see the area of depression below the bags of the lower lid disappears essentially instantaneously with the use of filler. And this filler tends to last a very long time in the lower lids. Up to 2 years. Now you can see, after correction of the right tear trough, that the depression that was below the lower lid, which can accentuate the lower lid bags, has been corrected fully and instantly on the right side. Now we're going to start moving to a new area of treatment, and in this case it's the medial cheek, and we're trying to plump up that medial cheek and reestablish the volume that's associated with youth. So we're going to start needle. You can see the results are almost instantaneous, needle. And will provide a long-lasting correction. So you can see now that we filled in the left cheek now, the fullness in that cheek, very nice contour blending into the lower lid, compared to the right cheek now, which still has a concavity in the mid-cheek area. And that difference is quite evident. I'm going to get Lily to turn just a little bit obliquely here, and then obliquely this way. And you can see quite a difference in that cheek contour. Very youthful looking result and very natural looking result. We're going to start now with the right cheek. Needle. And the product we're using here is Perlane, which is one of the Restylane group of hyaluronic acid fillers, which are temporary fillers and tend to be long-lasting. So we've just finished the cheeks, and Lily has a very nice correction, a good symmetric result. Normal to have a little bit of pinpoint bleeding when you do these injections, and that's all settled down with a little bit of pressure. Also a little bit of redness in the cheeks, which is temporary, of course. We'll now start with the nasolabial folds or the smile lines, and in Lily's case these are fairly subtle and we'll need small volume correction. Yeah. And you can see instant correction of that nasolabial fold. Makes the nasolabial folds shallower, and you can see that instantly. So we've completed that right nasolabial fold now, and if you compare the two sides, you can see how soft the nasolabial fold is on the right side compared to the depth of the fold on the left side. That's a nice correction. Lily now has a full correction of the left nasolabial fold now with very, very soft contour now. And we'll be starting with the chin next. So we're going to start with the chin now. Lily has just a slight decrease in projection of the chin. It's most noticeable on the profile. And without using a chin implant or any kind of surgical procedure, once again, you can simply fill that area with a temporary filler. First needle. This will add to facial balance and harmony. This will increase her chin projection. Also, people with narrow chins will benefit from this, as you can also widen the chin contour and you can carry the injection more laterally and improve the transition to the early forming jowls. Now we're going to start the pre-jowl filler, and in Lily's case we're going to be filling just anterior to the jowl. Now she's very subtle early jowling, and so she'll need a fairly minor correction. But this will camouflage early jowling and avoid things like mini facelifts or facelifts. Let me get started. So as you can see now, Lily has a nice straight jawline. That jowl has essentially disappeared and has been camouflaged by a small amount of filler anterior to it. Now we're going to do the other side. So we're finished now, and the total procedure time is approximately 30 minutes. Lily has a fantastic result. Aftercare is very simple, and simply she can put some cover-up makeup on to cover some of the pinkness in the cheeks and areas of treatment. And we'll see Lily back in a couple of weeks.
So it's been 2 weeks since my procedure, and I feel great, and I have a lot more confidence. My friends tell me that I look younger, that I look amazing, and have asked me what it is that I'm doing. I'm surprised at how quickly I healed and how simple the procedure was. I had minimal bruising that I was able to cover up with makeup. I had minimal swelling, so I was able to go to work the next day. I'm very happy with my results. The area that I noticed the most difference is around under my eyes. I don't look as tired as I did before. Moving forward, I think I would like to perhaps make my lips fuller and work on my skin texture and tone with some of the laser procedures that they have here.